Ankle pain video. Anterolateral ankle pain. Anatomy. You can see the tip, the fib, and the talus. This is the ankle joint with the ligaments that surround it. You can see the syndesmotic ligament, and if it is injured, you get a high ankle sprain. You can also see the anterior talofibular ligament. We call it the collateral ligament. If it is injured, you get an ankle sprain. The high ankle sprain is a sprain of the syndesmotic ligament or a tear of that ligament. It connects the tibia and the fibula. It is really a bad sprain. The diagnosis of this injury is usually done by the use of stress views or CT scan. This patient may require surgery. Anterolateral impingement, a painful limitation of the range of motion due to soft tissue or bony pathology. The soft tissue thickening and adhesions and fibrosis commonly seen in athletes with prior injury that extend into the ankle joint. Arthroscopy and debridement of the ankle may be helpful. A tibial bony spur can impinge on the talus and causes an ankle pain and limitation of the range of motion. Here you can see the spur on the anterior lip of the tibia touching the talus during dorsiflexion and limiting the movement of the ankle. The patient may need debridement of that spur. Ankle sprain. In ankle sprain, the pain is usually anterior and around the fibula. When the ankle is forced into that unusual position, the ligaments are torn and it can be a partial tear or complete tear. Treatment: immobilization, ice, physiotherapy, and rarely surgery. With an ankle sprain, the patient will be able to walk, but the ankle will be painful. With a fracture, the patient is usually unable to walk. Pain that's posterior to the fibula can usually be caused by injury or pathology of the peroneal tendons. The superior peroneal retinaculum usually is holding the two tendons in position behind the fibula. Lateral ankle pain. Patients with peroneal tendon problems usually describe the pain in the outer part of the ankle or behind the lateral malleolus. The problem occurs where the tendons glide within the fibrous tunnel. Peroneal tendonitis. It is inflammation due to excessive repetitive force causing pain and swelling. Peroneal tendon subluxation is almost like an ankle sprain with the peroneal retinacular injury, usually the superior one. It occurs with dorsiflexion and the eversion of the ankle. Posterior ankle pain anatomy. Achilles tendinitis, irritation and inflammation due to overuse of that tendon. There is also pain, swelling, and tears within that tendon. Achilles tendon can also rupture with age, lack of use, or by aggressive exercises. The Thompson test is helpful in the diagnosis of Achilles tendon rupture. When you squeeze on the calf muscles, there will be no movement of the ankle. Posterior ankle impingement can occur due to the os trigonum or large posterior process of the talus. It usually occurs in athletes such as ballet dancer. It may be seen in association with flexor hallucis longus tenosynovitis. Medial ankle pain anatomy. Tarsal tunnel syndrome. Compression on the posterior tibial nerve produces symptoms of pain, numbness, and paresthesia of the foot. When conservative treatment fails, surgical treatment for release of the tarsal tunnel is needed. Posterior tibial tendon tear. It is a common problem, but also a problem that can be missed. When the tendon is torn, you can find too many toe signs, loss of the medial arch height, or pain on the medial side with weight bearing. Global ankle pain can occur due to arthritis of the ankle joint, which commonly occur as a result of prior injury or inflammation. It can be diagnosed with exam and x-rays. Global ankle pain can also occur from osteochondral lesion of the talus. Arthroscopic debridement may be necessary in some situations. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.